In Bolivia, the healthcare system there has been overwhelmed by the coronavirus pandemic. Most of the more than 80,000 infections are in the capital, La Paz, where hospitals, laboratories, and funeral homes are close to the verge of collapse. In just 5 days, police there collected more than 140 bodies from the streets.
In this car, a 68-year-old man has died as a result of COVID-19. He never made it to hospital. Just a few hours earlier, a friend and family members had tried to get him help at 5 medical centers, but they were denied. All the hospitals are full. We were sent to the hospitals in La Portada and in Cotahuma. He stopped breathing when we were underway, and that's why we're here. The dead man's sister says her goodbyes while the police examine the corpse. An officer hands over the death certificate since the coroner hasn't turned up. The officer says people aren't just dying in their cars, they're also dying on the street and at home. Hospitals are at breaking point, and it's becoming harder to access treatment. While searching for help, people often go from one hospital to the other. Some of them die in their cars. Our department records deaths that occur in private vehicles and on public transportation. Bolivia is currently in the community transmission phase. Santa Cruz, La Paz, and Cochabamba are the worst affected regions. The average age of death is about 75, with more men dying than women. Rebecca's father died in his home because no hospital in El Alto would admit him. All we can do is bury him. That's all we can do. My father is no longer with me. These stories of being shuttled from hospital to hospital are repeated every day during the pandemic, and there's no end in sight. Cemeteries are almost full, and funeral parlors have run out of coffins. This man complains that he had to say goodbye to a family member in a particularly painful way. They simply put him in an improvised box. You can't even barter with them about the price, saying you're willing to pay for better. But there is nothing else. Family members aren't even allowed to enter cemeteries, and they have to say their final goodbyes from afar, tossing flowers at the procession of cars bringing in the bodies for burial. And every day, police pick up an average of 70 bodies from the streets, 85% of them infected with COVID-19.
For more on this very difficult situation in Bolivia, we're joined by DW's Javier Arguedas from our Latin American desk. He's just back from the region. Nice to see you again, Javier. These are some harrowing images we're seeing in that report. Can you tell us about the regional differences in what's happening?
Well, as far as we know, and according to official figures, the cases and the deaths are happening mainly in the 2 most populous cities, which are Santa Cruz and El Alto, which is adjacent to La Paz. But the thing that we're seeing here is the total collapse not only of the health system, but also of testing and statistics. So the truth is that we don't really know what's going on. You have the impression that there are more fatalities in the urban regions and not so much in the regional parts of the country. But the truth is that this situation is unfolding very quickly. Up until a few months ago, we had the impression that Bolivia was actually doing quite well with the coronavirus crisis, and now the truth is coming up.
Are there economic or class differences in who's dying? Is it mainly the poor, or are the rich and the well-off affected as well?
Well, as in every other country, especially in Latin America, there are differences, of course, in what regards to access to the health system. Of course, those who are privileged have more access, and they can even pay to get access to a hospital, for example. This is happening throughout the continent. But the truth is that this has been spread to such a broad amount of the population that you can't really tell where there's a concrete difference in classes in this case.
One of the approaches that Bolivians are taking is they're turning to chlorine dioxide. We're reading it's a toxic disinfectant. What's the government been saying? Has it been trying to clamp down on that?
Well, the official position is that you should definitely not take chlorine dioxide. This is also the government has been urging people not to do that. But you have the opposition. Let's not forget that Bolivia has a political conflict right now. And the opposition party has just passed legislation. They have a majority in Congress to produce and to sell chlorine dioxide to the people, saying in a very populist move, We are here for you. We are giving you a quick and cheap solution to the problem, and the government cannot provide you with proper medication and with proper measures. So this is a very big problem. And let's not forget also that Bolivia has a tradition of indigenous populations that tend to accept alternative medicine in general, which can be very effective for some diseases, but of course not for coronavirus.
What's behind, specific to Bolivia, the collapse of the healthcare system there?
Well, the easy answer is spending. Bolivia spends about $450 per capita in healthcare. Compare that to more than $2,000 per capita in countries like Cuba or Chile, to give you an example of both left and right. And the other problem is the coverage. People do not have that much access to healthcare. But the more complex problem here is probably that coronavirus is about prevention too. And Bolivia is a country with more than 30 official languages. Having a campaign to tell people to wear a mask, to stay home, or to wash their hands is not as easy as it is in a country where you only have to do it in Spanish, for example. And on top of that, you have a general, as we just mentioned, disbelief, if you will, in traditional medicine. That is also a very big problem.
Okay, Javier, great to see you back in Berlin again. Thanks so much for coming in on this today.